This is Cleo. She's going to be my patient today. She is a 9-year-old Staffordshire Terrier mix female spayed. And I'm going to do a physical exam on her. She weighs 54 pounds. And I'm going to start with her nose. So examining the nose, I don't see any discharge, no crusting, no redness. I'm going to move on to her eyes next. Her eyes are good. Her sclera is white. There's no redness or discharge in either eye. Gonna lift up her gums and check out her teeth. She does have mild tartar on her premolars and molars, and she is missing her incisors, all 12 of them, and all 4 canines. She does have some mild tartar buildup, also on the left side on her molars and premolars. And then next I'm going to look at her ears. I don't see any discharge or waxy buildup, no redness in either ear. They both look clean and healthy. I'm just going to feel her submandibular lymph nodes, and they're both the appropriate size and they feel symmetrical in shape. And next I'm going to just feel her prescapular lymph nodes, and those are both similar in size again and symmetrical in shape. And then next I'm going to do a little brief neuro exam on her. So I'm just going to check her menace response, cover one eye, and make sure she's blinking in both eyes. And then I would do a pupillary light reflex, but I won't turn off the lights because it's hard to see on video. So just cover one eye and then make sure that her pupils constrict when I shine the light in them. And that looks normal. And then next I'm going to listen to her heart and her lungs. And first I'm going to take a pulse. And her pulse is right at 80 beats per minute. And I'm just going to quick listen to her heart on the other side. And her heart sounds good. I'm not hearing any murmurs. The heart sounds strong. It's not muffled. And I'm going to listen to her lungs for about 15 seconds or so in each lung field. Make sure that I'm not hearing any cackles, no wheezes, and that the lung sounds aren't too harsh. And they're sounding very good on the right side. And next I'm going to attempt to listen on the left, as much as she will let me. Her left side sounds good as well. No cackles, no wheezes. Okay. And her respiration rate is right at 24 breaths per minute. And next I'm going to, as I run my hands down her back, just do a quick body condition score as I feel her spine and her ribs, which I can palpate easily with minimal pressure. So I put her body condition score right out of 5 out of 9. I'm going to check her skin quick. There's no redness or irritation, no pruritus or pyoderma evident, no sign of fleas, and she's got a good healthy coat with no dander. And then next I'm going to palpate her abdomen. She prefers doing everything in lateral, so it makes it a little more difficult. On abdominal palpation, I don't feel any masses. Everything is soft. There's no pain. She's not tensing up or anything upon palpation. And then next I'm going to examine her perineal region. Her vulva looks good. There's no sign of discharge, no redness. It doesn't look like she's been licking at it or bothering it excessively. And her rectum looks good. I don't see any signs of anal gland swelling or excessive scooting. That looks like it's good and intact. We'll take a temperature on her quick. And her temp is right at 101. And then next I'm going to palpate her joints. So her right stifle does have some crepitus, moderate joint swelling, and she does also have a luxating patella. In her right carpus, there's also some crepitus and moderate joint swelling. And then in her, roll back, sweetie. And then in her left stifle, there's also crepitus and moderate joint swelling. And then the same thing can be felt in her tarsus. And then thoracic limbs. She's got good range of motion in all the joints that I've felt so far. There's no sign of crepitus in her thoracic limbs. And then last but not least, we'll finish the neuro exam by evaluating her gait. Come here. Get up. Come. Get up. Get up, get up, get up. Good girl. Come here. So she has a good gait. You can see a little bit of muscle wasting around her hips, which goes with the arthritis that she has. Can you go back that way? But her gait looks normal. I don't see any ataxia. All right.